Hello, everyone. Welcome to the Revenue Cycle Decoded podcast. If you're a new listener, I'm glad to have you. And if you are returning, welcome back. My name is Gina Cornett, and I'm your host, and we are breaking down all things revenue cycle. If you are in revenue cycle, whether it's patient access, medical billing, financial counseling, practice management, you already know that talking to patients about their bills can feel awkward. Avoiding the conversation only makes things worse. Patients get confused, frustrated, and blindsided by bills that they didn't expect. And when that happens, guess what? It's harder for them to pay. And it's harder for us to do our jobs effectively, and it decreases their satisfaction with the practice or the organization. So, today we're going to break down why you need to talk to your patients up front, how to break down billing and collections language into something they actually understand, what to do if your patient finds an error in their bill, and how to handle tough conversations with empathy while still keeping things professional. Let's get started. So let's start with the big one. Why do so many revenue cycle professionals avoid talking to patients? Well, some people don't feel confident explaining costs. And if that's the case with you, we can help you. I have a very short course that can really help you understand the costs that patients experience in their insurance plans. Some people assume that patients already know their financial responsibilities, and I have heard this from practices that have said it's not our responsibility to educate patients about their insurance plan. Guess what? Yes, it is. And others, well, they just don't want to deal with an upset patient, or they feel awkward about talking about money. So, really avoiding these conversations, it doesn't make the problem go away. It just kicks the can down the road. And here's some reasons why it's more important than ever to have these conversations with patients. They're paying more out of pocket than ever before. High deductible health plans are the norm now, and many patients have deductibles of 5,000 or more, meaning they're on the hook for a significant portion of their medical bills before insurance ever even kicks in. And a lot of patients don't really understand their coverage. They might assume that their insurance covers more than it does, or they might not know that coinsurance means that they still owe a percentage after their deductible is met. When patients don't understand their bills, they're more likely to ignore them or dispute them or just flat out refuse to pay. So, the best thing that we can do is to talk to them early and talk to them clearly. So, how do we talk to patients about their bills without sounding like a collection agency? We know these conversations need to happen. How do we do it in a way that helps them instead of making it uncomfortable? Here's a few strategies. The first is to use patient friendly language. Patients aren't revenue cycle professionals. They may not understand terms like coinsurance, EOB, or non covered service the way we do. Instead of saying your coinsurance will apply after your deductible is met, try this. Right now, you haven't met your deductible, so this bill is your responsibility. But once your deductible is met, your insurance will start covering a percentage of the costs. The goal is to explain, not confuse. Keep it simple, clear, and relatable. Be upfront and transparent. Nobody likes surprise bills. And in fact, we now have the No Surprises Act, where certain requirements have to be met if a patient is uncovered by insurance or chooses to pay out of pocket. But really, for all of our patients, the best way to prevent our patients from being surprised by their bills is to set expectations early. So instead of saying, we'll bill your insurance and you'll get a statement, try, based on your insurance, we estimate your responsibility to be about X amount. This isn't a final bill, but we want you to be prepared. This approach builds trust and it helps patients plan ahead. And I cannot tell you how often I've gone to a physician's office or even worked in offices where it was, we'll send you a bill later. Don't worry about the cost. Well, of course, patients are going to worry about the cost. So the next strategy is to offer solutions and not just statements. When patients can't afford to pay their full bill, the worst thing you can say is, you owe this amount, and then just stop talking. Instead, be proactive about payment options. Offer payment plans. We can set up a plan that works for your budget. Explain financial assistance. If you're eligible, we have programs that can help. Direct them to resources. Would you like to meet with a financial counselor? Making it clear that there are options helps patients be more willing to work with you. So, what to do when a patient finds an error on their bill or thinks they have? Billing errors do happen, and sometimes it's a simple mistake, like putting on the wrong primary diagnosis on a claim. Other times it's more complex, like a procedure being coded incorrectly or a payer processing the claim incorrectly. But either way, patients notice and they will ask questions. So when a patient calls saying this bill isn't right, here's how to handle it. First, stay calm and listen. Patients are often frustrated when they call about a bill. Instead of jumping in with a response, let them explain what they think is wrong, and then acknowledge their concern. Even if the bill is correct, you don't want to dismiss them. You can say, I understand why that would be concerning. Let's go through it together. Review the details. Look at the claim, the charges, and the insurance processing to see if there is an actual mistake. And believe me, I have found mistakes on my own bills. If there is an error, fix it quickly. Mistakes happen, but when we own them and correct them fast, it builds trust with the patient. And if the bill is correct, explain it clearly. Walk them through the EOB or breakdown of charges so they understand why they owe what they do. For example, a patient might say, I was told this was covered. Instead of responding, no, it's not, you could say, I see where the confusion is. Your insurance does cover this service, but because you haven't met your deductible yet, this amount is still your responsibility. Now, let's be real. Not every patient is going to take this conversation well. Some will be upset, frustrated, or even flat out angry. So, how do you handle those moments without making things worse? Stay calm and listen first. Do you see how often this comes up? Stay calm and listen. Seek to understand. If a patient is frustrated, let them vent before you respond. Sometimes they just need to feel heard. Acknowledge their feelings. Instead of saying, that's just our policy, try, I understand this is frustrating. Let's go through this together. And focus on solutions. Even if they don't like the situation, offering a next step, such as a payment plan or financial assistance or a willingness to review the bill, keeps the conversation productive. And never take it personally. Patients aren't upset with you. They're frustrated with the system. Your job is to guide them through it. So here's the final takeaway. Don't avoid those patient conversations. Be upfront and use language they actually understand. Offer solutions, not just statements, and handle tough conversations with patience and empathy. Talking to patients about their bills isn't just a nice to have skill. It's a critical part of revenue cycle success. When patients feel informed and supported, they're more likely to pay their bill, less likely to dispute charges, and much more likely to trust your organization and feel satisfied with their care. Whenever you're ready, here are 3 ways I can help you with your revenue cycle career. Join my Revenue Cycle Bootcamp Facebook group to connect with others, ask questions, and swap insights in a safe and collaborative environment. Subscribe to my YouTube channel for more step-by-step guides, practical advice, and industry insights. And check out my courses on revenuecycledecoded.com if you're looking for structured, in-depth training to level up your revenue cycle skills. If this episode helped, share it with your team. And if you've had a tough patient conversation that actually went well, I'd love to hear about it. Drop a comment wherever you're listening. Thanks for tuning in, and I'll catch you next time. Peace out.